Good morning. My name is Richard Seeline. I'm the co-founder of the Resilience Innovation Hub and managing partner of Resilient H2O Partners. We're fortunate again to host with the Insurance Information Institute and our good colleague Michel Leonard from the Institute, our now fifth lightning round with great technologies solving important problems across the country and frankly around the world. This morning we are focused on reopening America, obviously with the pandemic now at a year old and unfortunately still in some form of progression. The good news is that we seem to be coming around some form of the corner, leaving us with an opportunity to return to functionality with our employers, employment, industries, communities. So this morning we are going to hear from three companies that are driving the reopening of America from three different technology perspectives. The other important fact about all three is that they are diligently working with a unique mixture of clients and customers across the country, all of which impact how we are de-risking the reopening of America. So we're going to hear from three companies that essentially are driving the de-risking, but also providing confidence for owners of facilities and a variety, as I said, of different types of operations, from hotels to large venues to public water systems. So with that, I'm going to jump forward into our presentations by introducing Tomer Mann with 22 Mile. Tomer and I got a chance to get to know each other once we heard about how their unique system is allowing the entry of a number of employees faster, but also more efficiently and frankly, in a more health perspective of their wellness. So Tomer, I'm going to hand it over to you and then we'll follow up with Santiago Mendoza, who will explain his product and their unique solution for air handling. And then finally, we'll hear from James Heisner with Biobot and how they are working with public water systems. And finally, we'll have good insights and closing observations from Michel with the Institute. So with that, I'm going to turn it over to Tomer and let you jump in.
Good morning, everyone. Thanks, Richard. I want to just give a quick intro about 22 Miles, who we are, and what we're doing and how we're moving forward in the industry. Richard told me to add a little timeline, and that's what I'm showing here. We were founded in 2007. We're very much a Silicon Valley-based company. We're founded in San Jose, and we continue adding features into our experience that we're getting recognized for. There's different milestones along the way. And in 2020, 2021, even though we're in March, we've had a lot of success over kind of the things that we've pivoted in March around COVID, leveraging our existing software, existing feature sets that along the years we continue to enhance. The reason for that is that our founder is the head engineer, and behind him we have 50% of our employees are software developers. So we're very much an R&D company, very much a Silicon Valley cultural, innovative mindset that continue to grow and enhance our product lines. And in March, when we were seeing a lot of the temperature scanning solutions coming out of China, coming out of Asia, we realized that we can leverage our existing software to kind of pivot and create a more secure solution, avoiding some of the sensors that are coming out of China that are honestly blacklisted in the trade market, and also avoiding the data breach implications that were coming out of them, especially for government entities or other research or secure kind of facilities that were trying to continue from an essential work, keep their doors open with a better safe and hygienic kind of approach. And that's what the temperature scanning solution kind of derived from. And because of that, we were able to kind of understand that there's more of this new journey that we can leverage off of the entryway, off of the lobby, which is the very first point of contact for visitors and for staff, for manufacturing, for different commercial buildings, for obviously for healthcare, education, even K through 12 was starting to request this type of solution. It wasn't, it was actually more them than colleges that were asking for this type of application. Theme parks were obviously always trying to stay ahead of the curve and add something to still keep their customers coming in. Same thing with retail environments. And so we developed our what we call Temp Defend to be the first point of contact for scanning individuals that had a face mask detection on it. So we let people know you're not wearing a face mask as well. And then we started evolving that, leveraging our existing feature sets, and then created this new workplace workflow. So from that entryway, we now added badge integrations or access controls. So now we've got visitor management and staff integration from a tracing perspective, from a data tracking, analytics, and understanding of who, what, from a pass-fail perspective is coming into the building or wasn't allowed to come in the building because we would kind of deny them entry as well. We added facial recognition capabilities, which is per enablement. So if a customer doesn't want that, that is not enabled. It is stored within the local system. Again, we were all about data. We were all about privacy and securing this information. And then we realized that there is all of the rest of the floor that we still want to keep safe and kind of keep agile for business continuity. So then we leveraged our interactive wayfinding with hoteling and hot desking. So if we're talking about reopening plans and there's the shift in employees coming 2 to 3 days a week now instead of full time into the office, and they're sharing desks, we wanted to have a more sanitary experience so they can find their desk, get there, reducing the cluster with one-way traffic flows, leveraging our 3D engine and wayfinding algorithm. And once they release the desk or they leave, we can notify maintenance to clean that desk. So now we've got that hygiene and safety from an agility perspective in a visual way. And then same thing with the meeting rooms. Now we've got occupancy control as well within the experience. So we can let you know only 4 people can get into this one conference room, or this one huddle room can only have 2 people. And then let me show you how to get there in a more seamless and one-way traffic flow for social distancing purposes and all of that. And in between all of that, if you've got any questions, now we've added a virtual receptionist. So we're keeping that human interaction in place, but reducing the face-to-face physical interactivity. And so we've got this dynamic, whether it's on the temperature screening or on the touch screens or on a separate unit, a video call solution that now you can connect live with an individual. And if you failed, let's say the temperature scanning, they can give you a follow-up information. If you want to find a certain individual, now you can talk to them and they can even see your temperature if we wanted to enable that feature. So the admins or the individuals that are getting called, again, can safely interact with the individual, the tenant from a commercial building, the customer or the client, or the student in a school. And all of that is backed by our one CMS that, again, we've started developing in 2007 and continue to enhance. And so that leads us to that entire journey. So again, we're starting in the entry, the lobby way, with the temperature scanning system that is doing a body temperature. And as soon as you elevate over, let's say 99.6 or 100.4, so you can offset the temperatures at whatever you feel comfortable with. And it'll do an alert. It'll do an email to the certain security or admins. It can then have voice recognition so you don't have to touch the screen. So from a hygiene perspective, it can also then say, do you want to make a call because you failed and you want to talk to someone, or you're a delivery truck driver and you don't want to get in, but you want to, again, say that you're leaving a package behind. So you can voice activate that video call experience. Then you're walking into the floor, and now you've got the wayfinding for the hoteling, for the hot desking, which we've added voice control and gesture control and a mobile control capability. So again, we're avoiding the touch experience, but keeping interactivity in play. And so now you've got the secure mobile control that you can operate the screen from your phone as though it's a mouse cursor on the screen. And again, from there, you're going into a mobile solution or a room booking experience or a hot desking experience. So again, everything is tracked, everything is visible, and everything has occupancy and density group controls based into it. And then you've got the visual communications, the infotainment, the COVID-related information, the HR information, and the kind of immersive experience around this new journey. And that's kind of what we've done, and literally started this new journey in April. So we pivoted and developed that really quickly from a safety, agility, and a business continuity perspective. So that's kind of what we've been doing, and we've gotten a lot of success in it. We were very fortunate that we did very well in 2020 because of these solutions. And I think 2021 is going to be an amazing year because the digital transformation is what's going to keep people safe and more agile, and also more informative on how to avoid these things in the future. And obviously keeps everyone happy and keeps the businesses flowing. And if we're talking insurance, obviously insurance rates and all of that stay leveled off. So that's it from me, Richard. Any questions?
Yeah, Tomer, that's great, and thank you for providing it. It is a journey, as you said, because I think the reality is that last March and April, a lot of us were at a standstill with not much guidance and trying to figure out what it meant for our workplaces and with our employers. Couple of questions, and you and I got to know each other around an unusual deployment, which is the San Antonio rodeo, and I want to play off of that a little bit as a lesson, because it wasn't just the event and it wasn't just the management of the venue. They had to comply and frankly get the sign off from the county health department, the city health department. What's been your sense of that interaction between your equipment and solution, the end users, and this kind of confidence building that is pretty much a requirement with the local health officials? What's been your sense of how y'all have impacted that, or what that integration begins to look like?
I like how you added the y'all in that entire scenario.
Thank you. I thought you'd pick up on that since I did talk about rodeo.
Yeah, exactly. The whole rodeo. I think it's all about the data, right? And it can show the pass-fail experience. Sometimes they don't want to see the actual body temperature from a privacy, and the pass-fail is really about ones and zeros. It's a timestamp. So again, we're all about privacy and securing that information, and that log can easily be shared with the health system out there, the department, and they can understand how many people are walking in that shouldn't be walking in versus how many people maybe were blocked or anything like that, to see if the organization is doing their part, right? And so I think one of the things is the requirements to have that log be shared, but to avoid names or personal information, it's all about the timestamps and the pass and fail. And I think that allowed some comfortability for for opening these kind of venues and opening up these different buildings or corporations in the health department. If they saw an uptick at a certain level, they can go back to these logs and do some tracking, some trace information, and all of that. And and then maybe follow up on the timestamp and then get the information of this individual possibly spread this. And so they've got more data where they didn't have the visibility for it before. So the health department feels more secure and more comfortable, and the organization know they're doing their part with all of this digital information and digital applications that are providing everyone, including themselves, with a more secure and safe environment and experience.
Hey, Tomer, let me ask two maybe technical questions. How many individuals can be screened per hour or whatever is that kind of time block? Have y'all been able to see some performance? One way or the other, there's going to be a lag, because either I'm going to have somebody check my temperature, but as y'all have collected this information over the year, have you begun to see, or are y'all at that stage of seeing kind of what the time scenario looks like?
I think that what we're seeing is around 3 seconds a person. If everyone's walking, standing still,
right.
3 seconds a person is kind of what we're seeing. The system, we've also developed it where it's rapid tracking experience, where you don't even have to stand. You just keep walking. So we developed, we took what we were learning, and my team was working fast. And so we kept enhancing the solution, where a lot of K through 12 that were coming to us says, we can't have a line of 200 students waiting to come in the building, one at a time. We want them to continue flowing. So then we developed rapid scanning experience. So now no one has to stand. You just keep walking. And then we added an LED light, and it will basically flash red if someone is walking and they fail. So we continue to enhance the feature sets on that side to reduce the amount of queue. I think someone clocked in 700 people in an hour with our system.
Wow. So that, because I think it also gets to, you want the performance of the risk mitigation and the reduction of any kind of health impact, which is the intent. But at the same time, you want to have, like you just mentioned, the flow and the ability to handle. My second technical is that for some see this as a temporary, well, we're going to get through COVID-19. We'll get, clear after whatever the date that the CDC and others, give us the all clear. But from your perspective and your conversations with clients and customers, are they looking at this as a temporary, we're just going to use these units until we get some clearance, or are they really now looking at this as fully integrated into the whole system of their operations?
Unfortunately, most people see this temporary. Even the smart companies out there that you'd be very surprised, like, yeah, we're gonna be fine. And one thing that we have as a differentiator versus the other, like, one-off, like Android devices and stuff like that you're gonna end up putting in a closet because people don't think they need the solution anymore. And by the way, I think that they're always going to be needed, because there's the flu, there's multiple other viruses out there that can knock out a whole floor of employees or other individuals. And this thing can keep everyone safe. In China, they are doing this for over 16 years since they've had SARS-1, and with their 2 billion people, it's only a 1-2% are getting affected, which is still a lot of people. But in that kind of a country and that type of traffic flow, it's actually, because of these face masks and scanners, they're able to control that population in that. So hopefully we'll get there. I just don't think, I think we're at that SARS-1 or COVID-1. So I think we might need, unfortunately, another one of these pandemics, which it started with SARS-1, then went to MERS, then went to SARS-2, then the coronavirus. So once it started in China, every 4 or 5 years they had another pandemic. I think unfortunately might happen here as well, with globalization not stopping, or and the flow of traffic between different countries is always moving. But the benefit with our software is that they can evolve the product. So if they want to remove the temperature scan or disable that, they still will leverage virtual receptionists. I think visitor management, I think visitor management, access controls is never going to end, and I think it's becoming more and more popular. And we are seeing an uptick in demand for those features right now in those applications. And so the benefit with our solution is that because you're leveraging our existing software, which is a content management solution, so it's a full template editing suite, you can change the template to now remove the temperature scanning piece, but add our other widgets, let's just say, into the solution. And so you can evolve this product moving forward to whatever the trend or whatever the needs are of you, the organization, or the venue.
Let me wrap up with one last quick question. When you look at 2021 and kind of the horizon, everything from these large distribution centers between Amazon and Walmart opening up more and more distribution centers, as these larger venues, where do you see your big gains and big interest for 2021 for the company?
Visitor management, access controls, and hoteling, hot desking, the wayfinding experience, which is kind of our niche as well in the industry, and then touchless touch experiences, using more of the voice control, using more of the mobile control capabilities, and then just continue on with visual communications and big kind of mobile to video wall experiences as well.
Got it. Tomer, thank you so much for spending time with us this morning. I know you're going to stay on with us for a little bit more, but let us move to the next one. But Tomer, we'll have an opportunity, obviously, to share the full deck with our audience and have a chance also to follow up with you over the next several months. So thank you for joining us this morning.
It's my pleasure.
Santiago Mendoza. Santiago and I got a chance to be introduced, and unbeknownst to me, there are several products and several efforts underway across the country to actually change the dynamics of the entire air handling systems, from large-scale facilities to residential. And Santiago, I'd like to have you step in and introduce IVP and how you all got launched, and more importantly, how you're reopening America, which seems to be also part of your brand and message out there. So Santiago, you're up next.
Absolutely. Thank you, Richard, very much. And first of all, thank you for allowing us this platform to talk to folks and educate everybody on what integrated viral protection is doing, IVP. So my name is Santiago Mendoza, Senior Vice President of Business Development and Marketing for the company. And what we're doing today is, you said it earlier, we are reopening America. This company was actually founded by Mr. Michael Harani, who's by background is a physicist, a structural engineer, and an architect as well. And so Mr. Harani has a couple of different inventions under his belt. But back in March 27th, to be exact, he came up with a solution that he wanted to explore and bring about to see, because he thought, the COVID, the SARS-CoV-2 is in the air. He didn't think it was going to be a surface thing. He said it's in the air. So what he did was he took his invention and he took it to the Galveston National Lab, which is only one of two labs in the country that actually test with the actual COVID, SARS-CoV-2, COVID-19 or coronavirus virus. They tested this and they came back and they said, Mr. Harani, your invention eliminates, kills, destroys coronavirus at 99.999% instant in the first pass through. They ended up pushing it over 200 and such fold, and it did the same thing. While it was there, He said, Mr. Harani, we'd love to also do anthrax. He says, absolutely. And so we ask ourselves, why would they do anthrax? Well, anthrax is a gold standard when it comes to ORs, laboratories, and all that. If it can kill anthrax, they told them, you have now changed the world. And sure enough, it came back with 99.99% as well. Instant kill, first pass through. So we started immediately into the manufacturing phase. We partnered with several University of Houston Superconductivity Lab, Texas A&M Engineering Laboratory as well. We are backed up by MIT, by the Argonne National Lab, and Mr. Harani has been actually been in several, actually in many publications in 2020, as well as now in 2021. And I think our last count was almost 400 or 500 of those. But I'll tell you a little thing. We are the first and only biodefense indoor air protection system of its kind with a HEPA a heated filter inside. Again, we provide a 2-year warranty on this. We customize it into homes, into commercial homes, into commercial buildings as well. We're in hospitality, we're in schools across the country. We are actually providing a confidence for teachers, parents, and students to come back to school, for people to be able to meet a little bit better. One of the hotels that the company owns, the Intercontinental Houston Medical Center, we've seen an increase in occupancy, an increase in volume in our restaurant, because people do also feel safer. They know they're coming into an area where it's cleaner, safer for them to be at as well. Now, you mentioned reopening America, and absolutely. We actually started in the fourth quarter of 2020 when we started reopening restaurants. We partnered with the Texas Restaurant Association. We partnered with schools across the country, here in Houston, Texas, with the George R. Brown Convention Center. And why would we do that? Because as you can see, we found out that SARS-CoV-2 is transmitted through aerosol and droplets. And they're released into the air by the carrier and travels up to 26 feet, especially when a person coughs, sneezes, or even talks forcefully. And where does this happen? That happens in restaurants, at schools, in homes. One of the things that we also learned early on by Mr. Harani was that, guess what happens? During the summer, it is hot outside, especially in places like Texas, Arizona, Florida, those kind of things. So where do people go? People go indoors, where it's nice and cool. And we figured that these HVAC systems are actually super spreaders, because people are in there. Fast forward to another season. What happens when it gets cold in the winter? People go back inside, and they're inside in the warm and the heater. And once again, that happens all over. So it was very important to figure out a way to do that. Now, right now, there's several, like you said, there's several things out there that are actually HERV and MERV filters, HEPA filters, and MERV filters that have been out there. But one thing that we did find out through the scientists is that a lot of your HEPA and MERV filters out there, they actually only catch viruses and pathogens. When they do that, they do catch those. Well, guess what? It's only because they're 0.30 microns in size. Finding out through the scientific testing is that the coronavirus is 0.06 to 0.10 microns in size. So it's a lot smaller. So what's going to happen? If you have your best filters here, the viruses are going straight through. They're not being caught. If they are caught, they're not being killed. So what our filtration system does, it actually heats up to 200 degrees Fahrenheit, which is almost 400 degrees, 200 degrees Celsius, which is almost 400 degrees Fahrenheit, and it actually destroys the actual virus, the pathogens that are in there. And we're talking about influenza, we're talking about H1N1, we're talking about all the viruses that are out there. And here's the thing, Richard. Nobody was prepared. Nobody was prepared back in March. So we talk about insurance industry, we talk about mitigating risk. Well, guess what? This filter, the IVP filter, it will make sure that you are prepared moving forward for other viruses, other pandemics, because it'll be in place, it'll be in the HVAC systems. Like I said, we're opening America back. City of Baytown, the municipality, they've already implemented our technology into their buildings. And we're in hospitals in San Antonio, across the country, post-acute medical as well, hospital system. So you see us all around, and you're going to start seeing a lot of these businesses reopening again. IVP has led the development of this novel biodefense system, proven to eliminate the transmission, airborne transmission of SARS-CoV-2, which is a public game changer. Huge. Again, this is not just something we are saying. This is something that we are being backed up by public-private research projects in Texas, leading scientists, virologists, physicists, researchers, and we also have endorsements, of such organizations like MIT, the Argonne National Lab, which is very important. And again, going back to, you and I had this conversation the other day, Richard, about how these claims are being done out there that they can also eliminate COVID, SARS-CoV-2 and all that. Well, guess what? When they tested our product, when they tested our filtration system at the Galveston National Lab, that was the first time in history where researchers were able to report that they completely eliminated airborne SARS-CoV-2 from actual coronavirus, not a synthetic version, but the actual coronavirus safely in a single pass through the technology with no ozone or heat transfer to the ambient air. And that's important because you put our systems in place into buildings, restaurants, and all that. One of the questions that we get all the time is, it heats up to that amount. How is that going to affect? Am I going to have to lower the air conditioner temperature in my home or our business? Absolutely not. It does not affect. The proprietary technology that Mr. Harani and the scientists, researchers develop maintains that heat, controls that heat in there, and it doesn't allow it. I know you and I are meeting, but if you put your hand where the air vent is coming out of the filtration system, it's actually at room temperature, although it's being heated and killing those viruses inside. We do have several models now, several units, which is the V1, which is for venues, larger units. We have the R1, which is for personal use, homes, large offices, restaurant spaces and all that. And then we have the S1, which is personal, and that is a portable one that you can put in dorms, take with you to hotels. We're going to be in the hospitality industry with those as well. College dorms, like I said earlier. So again, this is very, very important to know that those places with our system are going to be able to have the safest and cleanest indoor space, not only at that point, but moving forward.
Santiago, thank you. This is exciting. Let me ask a couple of questions, because something that you raised, but also Tomer raised. Is the FDA, CDC, are they beginning to certify, approve? What's been the process? I know they're playing a little bit of catch up, but tell me, is there a certification approval process in place, or is that something that you all really have to present like you have, the real deep scientific analysis and assessment? What's happening with the product approval process?
Absolutely. So the approval process is the approval process. What I can tell you, because of the tested and proven scientists that did with our technology, we are actually FDA approved already to sell during this pandemic. So our and thank you for bringing that up. Our units here are actually FDA approved. And we actually work together with the CDC and third parties. So I'll give you an example. One of the hospitals, post-acute medical, we actually did a clinical study with them where we partnered with the CDC and a third party that measures airborne particulates within the room. So that was put into the room with actual patient COVID rooms. when those came back out, they actually showed, and we have those tests to show and share, they actually showed a high level of the coronavirus, the COVID, SARS-CoV-2 in the room. Then what we did was we actually put our systems into those rooms to circulate the air, to clean the air, and then we remove those out, and then we remeasure. We remeasured those rooms, and let me tell you, it had eliminated those rooms of the COVID, SARS-CoV-2 virus and all viruses. And that is incredible. That is incredible to do because, again, not only does that protect the room for the patient to continue recirculating that air, but also our healthcare heroes, which deserve as much protection as they can be afforded, because every single day they go in there, our doctors, our nurses, our respiratory techs, our environmental services, they go into and clean those rooms. Guess what? We need to protect them as well, and our technology protects them.
Santiago, one other question. Somewhat similar to what I asked Homer earlier. Is the company seeing the response from the market that this is a temporary scenario, or are they beginning to, as you all work with, like you said, hospitality, medical, are they beginning to see this as a long-term challenge, and is that where the product begins to move forward as well? Is that I'm sure that this was essentially or initially made as something that could be a temporary unit, but are you now seeing a longer-term interest and commitment to make this a permanent part of the HVAC system?
Absolutely. So long-term businesses, individuals, and all that are seeing. We have phenomenal partners, and also within the company, as I said, Mr. Michael Harani, Dr. Garrett Peel, who's one of our founders as well. They actually see that this is a solution to those long-term issues, because what people are finding out now, what you and I are finding out now, is that we talk about all these viruses in the past and how they are coming year after year after year. Pandemics are every certain amount of years. Well, guess what? The insurance company as well, they're seeing this as we need to find long-term solutions. Well, guess what? We have found a way to make sure that we have the cleanest and safest indoor airspace today, tomorrow, in the future, to ensure that these spaces, because guess what? We cannot afford it anymore. We cannot afford to stop our businesses. We cannot afford to function like we do every day. We cannot afford to go out and interact with humans, with people and stuff like that. We all miss that. That's part of us. So this is definitely a solution, long-term solution for that problem, and people are seeing it. Businesses across the country are seeing it, and they're putting it in place because of what we do.
Santiago, this is exciting. Thank you so much for sharing this, and I look forward to seeing you tomorrow in person.
Yes, sir. Absolutely. I will show you those units in person.
That's exciting. Thank you so much.
Yes, sir.
Let me now turn to Jennings Heisner. Jennings, I learned a lot about your product and y'all's efforts through Dr. Ted Smith out of the mayor's office in Louisville and the University of Louisville. This is a unique product because it's not going to be something that everybody will understand, nor is it a huge consumer market. It's a very targeted market in the public water systems and how we handle the treatment of wastewater systems. So I am excited that you all have already had some significant impact around the country. And as you'll discuss, it started with an initial health challenge before COVID came along. So Jennings, let me turn this to you and share with us how Biobot emerged and what's underway for the company.
Thank you, Richard. I really appreciate you guys giving us the space to talk about this. We really think it's a It's a unique approach to the public health system as we see it today. So let me tell you a little bit about our company. It's called Biobot Analytics. We are first and foremost a wastewater-based epidemiology company. You're right, Richard. It's not a piece of science that a lot of people have heard of, but basically what we do is we analyze sewage that is either coming into wastewater treatment plants or at the manhole level, and we analyze it for the presence of human health markers. So the company was founded in 2017 by the two women you see there on the right. On the left is Nusha Gailey, who's an architect and a smart cities expert. And on the right is Dr. Mariana Matus, who is a computational biologist and a wastewater-based epidemiologist. The company was spun out of MIT, where those two were doing doctoral research. And it was originally focused on the opioid epidemic. Richard, you're right. It wasn't a company that was even thinking about these kind of global pandemics like we have today. The opioid work that we did was focused on a couple of different communities, one in North Carolina, one in Massachusetts, but we helped each of them identify the presence of opioids within their wastewater to better inform their public health response. But come February of 2020, we saw a bit more pressing need for this kind of technology. And so we expanded our work into the COVID space. And we were the first company in the United States to identify the presence of the SARS-CoV-2 virus in wastewater. So let me tell you a little bit about how the actual process works as regards COVID. We basically leverage existing workflows within wastewater treatment plants around the country. It's really pretty simple for wastewater treatment plant operators to participate in this kind of research. The wastewater treatment plant operators have to take samples of their wastewater on a regular basis to fulfill EPA permitting requirements or state permitting requirements. And so basically what we do is ask them to send us a sample of that sample, which is then analyzed in our lab here in Cambridge, Massachusetts. Our world-class team of lab and data scientists then look at the results and report back as quick as one business day after we've received the sample. And so when you combine that with the idea that we're a very inexpensive approach when compared to widespread individual testing, you see the real benefit of this technology. I guess, shortcomings of relying on clinically reported cases for the COVID pandemic is that there's a large proportion of the population of infected individuals who simply will never become symptomatic. Or there is a large portion of the population that doesn't have access to the kind of testing that would show up in those clinical case reports. So by leveraging wastewater testing, you're able to get a look at everybody who has contributed to that individual wastewater treatment plant. Everybody goes to the bathroom every day. So we're able to get a real look at a high population level of what is going on within a certain city, certain county, a certain state, and give public health officials therein more actionable data to make really informed decisions. And so I'll show you a little bit about where we've worked. We've worked in over 400, actually that's a little bit of an outdated number now, it's over 450 different locations across 42 states in the United States. We've tested over 10% of the US population. Some of the communities with whom we've worked on the right, you'll see there everybody from the World Bank, the Commonwealth of Massachusetts, Miami-Dade County, Memphis, Tennessee. You know, we're a national and global player in this market. It's really pretty great to see. So I'll tell you a little bit about what we've done really within both of these spaces. I'll start off in the opioid space because it was the initial work that we did. The town of Cary, North Carolina, was our greatest partner when we did this work. We helped them sample at 6 or 7 different locations throughout their county. Initially, they believed they had a heroin problem within their downtown core. But after looking at our approach, they realized that they had a pill problem in the outskirts of town. So this fundamentally changed their approach to how they were addressing this problem within their community. They started doing more community outreach in these kind of outlying areas of town. They started instituting programs like pill drop boxes, which eventually led to more than 40% increase in the amount of pills that were being properly disposed of within their communities. And ultimately, it helped decrease the impact of the opioid epidemic within their town. I'll turn now to COVID, and this quote from Matt Meyer, I think, is really speaking to the idea of reopening America, this idea that if Biobot's testing can help a community open even a half day earlier, it's the greatest investment that he's ever made. And so the way that Newcastle County in Delaware was using this was, again, at the manhole neighborhood level. They were testing at 10 or 12 locations throughout Newcastle County. And when they saw a spike within the wastewater, they would then position a mobile testing unit in those communities the week after, so that those individuals would have better access to testing, thereby limiting the spread of possible new, spheres of infection within Newcastle County. This really speaks to the idea that wastewater testing is a bit of an early warning system, really. We published a paper this is probably 6 or 7 months ago now, showing that when you see a spike in the amount of viral load in the wastewater, some 7 to 10 days later, you'll see a correspondingly large spike within the clinically reported cases. So this kind of wastewater testing can really give a community a heads up of what is to come within, the area that they're responsible for. So we think that there is immense value in instituting this as a true piece of the public health infrastructure going forward. As I said, we ID'd the presence of SARS-CoV-2 in wastewater back in February 2020. So imagine if every community in the country had this kind of testing already installed within their sewer infrastructure. Think about the lives that we could have saved within the country just by identifying the spread at a more, rapid pace. We think that there is also use for this within the corporate sector. We are working with 2 Fortune 100 companies on this to better identify the presence within their corporate headquarters. So we believe that this is, while primarily a public health approach, there is absolutely use for it within the corporate space. Beyond opioids and beyond COVID, we can test for things like the flu, individual human health markers, diseases like hepatitis C. So we think that there is an absolute need for this to become a more widespread approach to testing population-level health in public health circles. So that's Biobot as a company. And Richard, would love to hear if you have any questions.
Yeah, Jennings, this is fascinating. And I knew a little bit about some of the testing in kind of the Midwest states that were really beginning to face the opioids crisis. Let me ask a couple of questions. You answered a few of them, but I want to drill down a little bit. This when you go from a large wastewater system, which is generally a very large collection, down to the manhole cover, this can really get to hyper-local ways of identifying where you're seeing, like you said, an uptick, which would lead to a potential surge in that area. Is that what's begun to really happen more and more, it sounds, is the connection of hyper-local detection, so that then the health system can, on everything from detecting to now also, where do you see this tie into the vaccines? What sense of the next kind of follow-on?
Yeah, absolutely. We are seeing more of an uptick in the uptake of this kind of approach at the manhole level. We have a number of our current partners who are doing this throughout their cities to get a little bit more of a granular idea of what is going on. As concerns the vaccines, yeah, we absolutely think that this should be something that states and cities continue to do for the foreseeable future. As great as the initial results for the vaccines seem to be, we're still not 100% sure of the longevity there. So if we can continue to test within our cities, this might give us a heads up as to if there are going to be future spikes, if the vaccine, proves to need a booster shot, that kind of thing. We're also now able to test for some of the most prevalent variants that are spreading throughout the United States, specifically the B117 or the UK variant. So with giving communities a little bit more information about how those variants are spreading, how they might affect vaccine efficacy, we think that there's absolutely use for this as we go through the summer and, into the rest of 2021.
And then, as I've asked everyone else, you've gone from opioids to now COVID. This is becoming more of a permanent activity. Is that what your sense is? Is that the public utilities, public water utilities, public health systems are truly looking at this experience as something that's more permanent rather than a temporary measurement?
From your mouth to God's ears, Richard. that is what we hope. At the end of the day, that this is going to be truly a permanent part of the public health infrastructure because of the things that I stated earlier, right? I mean, if this had been in place before COVID and we were able to kind of flip that switch to look immediately for this virus, it would have been a huge help. I think like Tomer was talking about, we don't know exactly what the next pandemic might be. So by instituting this kind of testing at this point, it can really help a lot of different communities, with the risk mitigation going forward. We think it's a really valuable thing for communities to invest in.
You raised one last question. You raised about the interest from the private sector. So there's a number of locations, where you have large corporate campuses, again, large distribution centers. Is that without asking anything that's proprietary in your strategy, but is that beginning to gain interest where you have large employers, large employment, large concentrations of that they can now test within their systems as well? Because there are, as you know, a lot of private water systems and, frankly, a lot of corporate campuses that run their own systems to some degree. Is that where you're seeing the drive now?
Yeah, we absolutely see a home for this kind of technology in those spaces going forward. I mean, I think you're right. With a lot of these large corporate campuses, with a lot of employees within them, there is a desire to keep everybody healthy. I think Tomer also mentioned the idea of flu and how it can wipe out an entire floor of employees at a given time, and we're seeing a lot of interest within that space, right? If we're able to keep a campus flu-free for an entire season, the increase in productivity that would result is something that a lot of corporate employers are interested in, beyond just the base level of keeping their employees happy and healthy. So there's interest, and we're hoping to, expand that interest as we move forward.
Jennings, this is, and I now really understand why Dr. Ted Smith and Louisville and other places really, have found value in what y'all are working on. I want to note that you and I were able to have this conversation without having anybody be offended that we were talking about wastewater and wastewater streams, which can be a challenge in a public setting. But at the end of the day, it is another part of our country's infrastructure. And it is a part of the public-private partnership. So let me ask for Michelle Leonard to join us. Michelle, you've gotten a chance to listen to all three, and from your perspective as both an economist and an entrepreneur, and then in your role with the working with the insurance community, what's your sense of what you've heard so far from the three companies and an overview of how the industry is looking at this reopening America?
Thank you, Richard, and thank you to all of our panelists today. These are exciting technologies, and they are very practical in their use. I mean, one of the things we've tried to do is to make sure to bring to market, or present technology that have either been brought to market already or are ready to bring to market. And that's the niche, I would say, that we've identified for the hub and our partnership with Resilient H2O and so forth, and the Canon. Now, what's important for me here is to bring the insurance perspective. As America is reopening, we want folks to know that the insurance community, that insurance carriers, reinsurers, and brokers are there to be part of the solution and to facilitate businesses, homeowners, and so forth, and their ability, and the ability of everyone to be able to move forward safely as rapidly as possible, and return to full business activity. And I would encourage everyone to look and turn to their carriers and seek advice. Frankly, one of the places that they can go is our Resilience Hub on the III's website, III.org, and we have many different technologies. We have videos, we have resources, and all of those different tools to get there. But we're excited. We've been doing a lot of work. We think of insurance as the first economic responder after physical response and so forth. So we are here as a resource, and really we want to be able to also integrate some of these technologies. So right away, listening to some of the presentations, we've identified, thought about some carriers, some of our members who may be very interested to leverage these technologies and help reopen in a safe way. And we're working hard on creating, convening folks, partners from across regulators, carriers, private sector, startups, so that these technologies also are part of the cost-benefit analysis. Carriers and insurers and local communities are aligned in terms of their financial interests. So doing the right thing in terms of how to reopen safely and so forth is also doing the right thing business-wise.
I think you just raised two, amongst many, but I think you just raised two great points. Let me play off, Michel, about the cost-benefit analysis, right? Because that is something that the private insurance market uses, FEMA uses, HUD, EPA are beginning to use, even the Army Corps of Engineers are beginning to really take a look at this cost-benefit analysis. As you see, we've gone through, flood, storms, tornadoes, now snow and ice, but this pandemic has been around now for over a year. As you look at the insurance sector, this has been something that really has been somewhat new to us on how to handle and manage. So as carriers, the insurance brokers, carriers look at this, what's your sense of how future products, insurance products, may emerge around handling these types of incidents?
Absolutely. Well, the industry, the insurance carriers, insurance folks in general, from carriers to brokers and reinsurers, we've been dealing with natural catastrophes and being there for our insureds for as long as the insurance industry has been around for 300 years. So we have a role to play. We know how we can help, and we're always looking for better ways to be there. Insurance, especially in America, is community-based. Go back to Benjamin Franklin and the organization, the creation of fire departments. That's why they're still in many cases volunteer-based across the country. So we see this mission of community service as differentiating us from some of the other institution organizations, firms and so forth, types of businesses and finance. And we take that very seriously. One of the things that you just mentioned is about the epidemics and pandemics are new, certainly in this way. but it's not going to be the last time. I think one of the panel, I think it was Tonar, who said, the flu and all these different things. And what I really took from that comment, it reminded me that as we go through catastrophes, as we go to the unusual pandemics on this scale in the modern era, we can also take away from this some technologies that will stay with us, some solutions that will stay with us. I mean, an obvious one is Zoom. We're not all going to go back. We're going to keep using Zoom. Everyone now knows, we forget about the mute button once in a while, but everyone knows how to use Zoom now. And that's going to be part of the way we do things. And I think, to Tonar's point, being aware of folks being sick, the flu, the lost productivity that's associated with that is significant, and it costs in terms of workers' comp and so forth and different things. So I think with some of these technologies, they can stay and they can make us more aware of health consideration in the workplace, and become more central to how we think of workplace safety and workplace conditions.
And that cost-benefit analysis that we're talking about, I think, is one where we're now getting a lot more data. Michelle, this goes to your, the core of your work, but we're getting a lot more data. So what we've heard from 3 different companies today is the collection of significant amount of data that's begins to form the basis of predictive analytics. Tell me how that fits into the cost-benefit analysis and.
Yeah, well, I think the cost-benefit there, the macro level, is privacy, and of course everyone needs to be very aware of that. And I'm not going to say anything new on that right here, because we're all aware of it. And as we add these considerations about health, the scanner can be very intrusive. At the same time, it's a tool. We need to know how to use it, et cetera. Folks need to be aware of how the data is, your disclosure, et cetera. Again, nothing new there. We just need to make sure that we can do that. Now, that being said, the insurance industry is very aware of collecting a lot of data, and we are extremely careful with that. We, cyber risk protection is so we take that extremely seriously. And now the cost benefit part is where we are trying to get as rapidly as possible, as efficiently as possible. You and I had a different conversation about that a few days ago, but being able to convene around the table, regulators, carriers, underwriters, different stakeholders, local communities, business, and so forth, to actually look at how insurance can be a partner along with others on that thing at the entrance of the building. If there are costs associated that carriers or local communities, local governments and workers' comp, government reinsurance schemes don't have to carry, that we can expect that to be different as a result of these technologies. I mean, there's a lot to be done. It's not new. I didn't know that until I actually went there, but one of our sister trade association organization is called the Insurance Institute for Highway Safety. They're based in Virginia, in Charlottesville, and they're the ones who basically invented the whole dummy thing. Dummies in cars and being crashed. I mean, I joke often, you've heard me say, Richard, that, we do economics, we do macro, we do insurance regulations and education. We can't compete with them when it comes to blowing up, crashing cars. But it's incredible how the research they've done, paid by the industry, has transformed the way car makers build cars. And, originally it could have been a confrontational relationship. But on the contrary, car makers, manufacturers, and the industry and regulators all came together, and it's an incredible success. And what we're trying to accomplish here in IBHS, which is another one of our sister organizations, they focus on building materials and safety and building codes and so forth. So we're hoping here, what we're doing is we want to duplicate some of this and applying it to the area of resilience. And I look forward, I mentioned this to you, trees fell here in upstate New York, just north of the city. I keep calling it upstate, but just north of the city. And I had a tornado, not common here. And I took some trees down, but I carried that cost. Carriers got a benefit. We want to get to a point where, whether it's a homeowner taking down trees to protect their building, their infrastructure, their home, or it's someone, a company buying and investing in these that they can build different technology we've talked about, we can get around the table and get to a point. But as you said, we need the data, you know, and it's not it's extremely important for one very simple reason. You know, we don't want to get ourselves into the industry, regulators, and insured want to make sure that there's enough money to pay all the claims. And if we actually, until we know what the impact will be, you know, we're not going to be there. So we're heading there. It's been done in the past, and we're just going to keep doing it.
Michel, I think this is great, and I appreciate your observations as well as Tomer with 22 Miles, Santiago with IVP, and Jennings with Biobot. I think one of the things I'm going to take away is, and it goes to your convening message, Michel, as you know, we're beginning to plan a future convening with some of the major real estate developers across the country. So I think this is where, as I kind of referred to it, and Santiago and Jennings, you may have heard me say, I think the domino is just beginning to fall about how this becomes not just an insurance, you know, realm. It's not just the entrepreneur's realm. It really is a collective wisdom of getting the right smart people around the table, looking at what our past losses have been, the challenges, and what can we do to mitigate future risk and future losses. So I really appreciate all three of our presenters, Michel, our continued partnership. This wraps our fifth lightning round, and I look forward to the follow-up and working with all three companies as we continue the journey together. So thank you very much, and thank you to all our listeners. Look forward to your feedback and questions. We'll have the information available for those who are watching so that you can follow up directly with each of the presenters. So thank you very much. Have a great day.